We think that being authentic is about remaining true to who we are, and many of us consider plastic surgery to be more the preserve of celebrities, your Caitlyn Jenner, your Chelsea Manning, rather than ordinary people. But in fact, plastic surgery has become seen as a way of trying to enhance or authenticate our inner lives. So should we embrace cosmetic transformation as a way of becoming closer to who we really are, or who we might want or aspire to become? Or should we be going the other way and saying that society is far too obsessed with appearance and that we need to push back against that? Well, to debate, argue, and we hope possibly even resolve, at least for a little bit, some of these questions, we have three fantastic speakers for you here today. On my left, we have Heather Peto, who is LGBT plus Labour, as in Labour Party's, transgender officer, and also holds a PhD in biochemistry from Cambridge. So we expect both ideology and science to be with us today, Heather. On the right-hand side, as I'm looking, we have Julia Long, who is a researcher into violence against women and the author of Anti-Porn, the Resurgence of Anti-Pornography Feminism, and she also holds a PhD in social science. And Miles Berry, on my immediate right here, is a plastic surgeon. He is in private practice. He has immense amounts of experience in this area. So three highly qualified people to debate this issue today. And before we start with the debate itself, we're going to hear from each of our speakers and get 3 minutes from them about what their position is on this debate about the connection between authenticity and plastic surgery. Heather Peto, can I start with you?
Yes, thank you, Rana. I suppose an invitation to myself and Dr. Julia Long and the subject of Caitlyn Jenner means that one of the parts of this question is if you're trans, does transitioning and does surgery help you to transition, and whether you need to change your appearance to suit society demands. I'd just say a few little bits about being transgender before I get on to the issue in the debate. I mean, like sexuality, gender identity for most of us is something that we've known our gender identity conflicts with our body from a very early age. And it's really tough growing up if your body and your mind is different. And you're exposed to all the role models and gender stereotypes of your gender identity, but you're then punished if you express yourself in that way. And society does portray men and women differently, and what in terms of clothing and makeup and image is regarded as sexy or beautiful. And trans women are exposed to these stereotypes just like other girls are. So just like most women, we feel inadequate when held up to images on the cover of Vogue. But wearing beautiful clothes and makeup does make us feel more confident about ourselves and empowered. There is an additional thing if you're trans, which is your body, your genitalia, for example, doesn't match what your head says it should be. And in a short talk, I can't explain or give justice to explaining the pain that gender dysphoria has. But in this debate, we are talking about what medical interventions you can do to change your body and whether that makes yourself more authentic. So there are three main ways that transgender people become more true to themselves, and a fourth, which is the full cosmetic surgery, which I think is really only available to the very rich. The first is social transition. I won't go into that too much because it's not really part of this debate. But the second is hormone treatment, and I would say that that is far more radical than most plastic surgery, and it's far more empowering. I mean, your body over a space of a few months does become more of what you want it to be. Your whole body changes, your secondary characteristics changes, and your mind changes as well, and with a positive psychological impact. So answering the question of this debate, I'd say yes, hormone plastic surgery, to give it that word, does make your body closer to who you are and so more authentic. For some, gender reassignment surgery is the way to go to change your genitalia to be more reflective of what is inside your head. To be, I won't be too crude, but sex is only a short part of your life, but it is a very important part. and having your genitalia matching what your mind is really important, as well as not waking up and going into the shower each morning and being reminded that you're somehow different. So yes, I'd say having sexual reassignment surgery is also important. When it comes to plastic surgery though, I think that's more complicated, and I think it depends. You know, I was reflecting myself, I do wear makeup and it does make me feel more confident. But why do I wear makeup? Should I be pushed into this idea of sort of like there's an ideal image to present? And if so, sort of like should I take something, if I had the money, as radical as plastic surgery? I'd say for myself, no, but I wouldn't criticise anyone else for doing so.
Thank you very much indeed, Heather, and we'll turn straight to Julia Long, your 3-minute pitch, please.
Thank you. So the question that we were given was, can plastic surgery make us more authentic people? I think we need to be quite clear that what we're talking about on this panel is cosmetic surgery. So we're not talking about plastic surgery in the sense of surgery that is done where an individual has experienced severe burns or injury or disease. We're not talking about that. We're talking about cosmetic surgery, which is done to otherwise healthy individuals on healthy tissue. So we're talking about a range of surgical practices, and I think it's also important to talk about other invasive procedures which might not be surgical but are becoming very normalised and very popularised through a lot of media narratives. So this word authentic we really have seen a lot of in the last couple of years, I would say, particularly in this area of so-called gender identity and the notion of having an authentic self. I find it quite troubling that there seems to be a shift away from what we understand as sociologists as the self, that obviously we all have some kind of sense of ourselves that is in relationship to the social world, the political world, the economic world that we inhabit. So this idea of authenticity is often, I think, used very ideologically in these kinds of discussions, or in terms of the claims of people invested in cosmetic surgery, to suggest that there's some kind of inner self that is pre-social, that is not affected by the kind of messages that we have from the media. Remember that obviously the media is extremely powerful and it's in the hands of very few very powerful corporations, and all of the economic interests that are at stake in terms of a hugely profitable cosmetic surgery industry. That we know it can be quite hard to find accurate estimates of the global worth of different industries. I've seen estimates ranging from 11 billion right up to 43 billion US dollars. But what we do know is that cosmetic surgery is a hugely booming business, both in terms of the surgical procedures and the very common, increasingly prevalent invasive procedures. So I want to start by raising a question. There's a woman whose story I was reading recently. I won't say her name out of respect, but I'll just call her Jane Smith. Jane Smith was a survivor of the PIP breast implant scandal that some of you will probably remember from the best part of 10 years ago now. 2012 was when that scandal broke. If you remember, with the PIP scandal, women had breast implants put into their bodies that had industrial grade silicone and were twice as likely to rupture than other implants. So there were 48,000 women in this country alone that were victims of this scandal. They waited 5 years for any kind of financial compensation. They got £3,000, which would not even cover the cost of the original operation. And Jane Smith, as just one example of these women, has had to have 5 further operations to try and correct some of the impact of having this toxic substance leak into her body. So we can raise the question, we've got all these sort of ideological words like authentic or confidence or boosting self-esteem. I would like to raise the question, is Jane Smith a more authentic person now with this toxic material in her body that can never be fully got rid of, that has affected her ability to work, her ability to raise children, her ability to function in the world, not to mention all the psychological impacts as well as the physical impacts? And I think we really have to get away from some of the euphemistic language that tends to be used in these discussions and start to think about whose interest is this serving? Who's making huge profits out of this? What are the implications in terms of sexual politics? Because we know that it is overwhelmingly men who are carrying out these procedures, and women, in this country, 90% of all cosmetic surgery is carried out on women's bodies.
For more debates, talks and interviews, subscribe today to the Institute of Art and Ideas at IAI TV.